Welcome to the Movement Professional Podcast, Dr. Frank Mallon. How you doing today, Frank?
I'm doing good, Chris. Thanks for having me. Honored to be here.
I'm glad to have you. It's good to be in touch again. We met probably years ago. It's got to be
Mhm.
about 5 years ago now. And the first time I met you was at the Cervical Revolution
Yeah,
course for the Postural Restoration Institute.
yeah.
And I think you're the original, you're the OG, right? Like as far as the certified in PRI in Pennsylvania, you're the first to ever get that.
Yes, I believe that is factually correct. Yes.
Yeah, which was it was a big deal to meet you, but what a good dude. And I think our we have a mutual friend, John Herding. So like
Yeah.
he had heard about you from him before meeting you, but it was great to meet you that day and had a decent relationship ever since. We're all in this world of building a cash-based physical therapy practice and going through the adventures of that. So
Yeah.
and I feel like the more we're in that business, you meet more people doing the same thing, and it builds a nice community of everybody's just trying to do their best for their patients, but we all offer a little different specialty. And I'm always fascinated. Like I follow you on Instagram a lot, and just I've actually been a patient of yours. I remember that back in the day, just
Yep.
to
Yep.
learn from you, and just your attention to detail, the way you look at the body is very unique and something that I learned a lot from just in our few sessions together. But I know you're doing stuff that's a little bit outside of the traditional box, like we all are. But maybe you want to explain like where you're at right now with your business and what are some of the services that you offer?
So I'm in the Philadelphia area, and I'm blessed to have good relationships with numerous like-minded people in the area that have opened up their spaces to allow me to be accessible to their communities, and some of it is different gyms or Pilates studios or integrative medicine practices, and so I am on site in about five different locations in the Philadelphia area. But one of the big pieces of the work that I do includes integrative on-site work with dentists and optometrists. If for anyone who's not familiar with, PRI looks at the patterns that our bodies tend to default to are dictated by the asymmetries of our body. So the every system of our body, whether it be respiratory or even musculoskeletal or the sensory systems, the vision system, they're all asymmetric. And so there's, in a lot of cases, when we end up with issues, whether it be a recurrent musculoskeletal issue and strain, or some sort of even more debilitating type of symptoms such as vertigo or chronic neck pain or chronic back pain, there's a lot of things that can be addressed by looking at making sure the harmony between the right and left sides of our body is optimized. And so the movements of our pelvis, our rib cage, and even our head and neck and those cranial bones, they all need to maintain a certain amount of synchronicity in order for our body to move in a fluid, non-compensatory state. So not everybody I work with, needs attention to things going on in their visual system or things going on in their dental system, but sometimes we do. And being able to have the relationships with those providers in those fields has really been able to bring about some powerful changes for people that may have been having some chronic, debilitating issues that weren't getting help with, by attacking it in some of the more traditional ways. And so I'm not a dentist, I'm not an optometrist, but I have relationships with people in those fields that are willing to accept my feedback in how the body's responding based on what they're prescribing somebody's glasses to be, or
Yeah.
what's going on in their mouth, or that kind of stuff. So I do a lot of just just the physical therapy piece of it, where it's just me and the patient. But
Hmm.
it's nice to be able to have the ability to pull these pieces in when needed, because a lot of people don't realize that these variables are affecting the issues that they're having, whether it be neck pain or, sometimes, it's somebody has chronic hip pain and it's coming from their teeth or
Yeah.
from their vision, and so, that's kind of the world I live in. And
Hmm.
not everybody needs those pieces, but I have a good amount of experience both as a patient and well, as a clinician, but really as a patient. And that's kind of how I got into it. So I had some pretty frustrating and debilitating health issues years ago, and it was a blessing that I found these methods. At the time, nobody around here was
Right.
doing it, so I went to where the treatment was. So I was flying out to Lincoln,
That's
Nebraska,
right.
frequently. There was a period where I was flying out once a month, and
Wow.
but it was the only thing that helped me. And and I had been through the traditional, medical system, and I was coming off a bout of cancer and had gone through 6 months of chemotherapy. But I also, in my history, had a lot of head trauma from playing football
Hmm.
all through college, and was really having a hard time functioning, and it was only getting worse. And everybody I'd go to, they say, you're just getting anxious. It's because
Mm.
when you were young, you know too much and this and that. Just you'll be all right. And but I knew I wasn't all right, and it was
Right.
and as we look towards, like, well, I was recently married, and I was like, we want to start a family, and I could see that it was just getting harder and harder to get through the days, and
Mm.
it was going in the wrong direction. And it wasn't until I was at a PRI course in 2014, and I was sitting in the course, and I at this point pretty much accepted and convinced myself that literally I was dying, that I thought I had ALS because I was getting all this muscle twitching,
Wow.
throughout my body. And I was going for EMGs every year, and I was expecting that each time, every year, that they would say, all right, look, go home, get your affairs in order. This is, it's finally showing up, so
Mm.
and I was sitting at the front row of the course, and this was actually before, like, it was called Cervical Revolution. It was the original, like, TMCC course,
Okay.
and Ron was teaching it, and it was the first day. After the first day of the course, I was sitting in the front row, and I had never met him at this point.
Hmm.
And he looked at me and he said, "Tell me about your eye." And I said, "What?" And he said, "Yeah, you have a left esotropic, whatever." And I'm like, "Oh, well, what do I do?" He said, "You probably have some health issues, don't you?" And he had never met me, never knew nothing about me. We had never spoken before. And I said, yeah, and I was just taking these courses, just trying to be a better PT,
Right,
not
right.
that it was really, that I thought I had some other stuff,
Yeah.
and fast forward a couple months later, things were just getting even worse. I found myself on a plane to Lincoln, Nebraska, and I went out there, and this was in the early days of when they were doing some of that integration work, what they now call the Prime program.
Hmm.
And it was, I got a dental splint, and I got some new glasses, and it kind of helped repattern my head on neck position. It helped regulate my whole nervous system. And I immediately felt a tremendous difference. I could feel my whole body relax for the first time in a long time. And that kicked off a journey, and in a way that was really a blessing for both me personally, but also professionally. So as I saw how much it helped me, and I saw how much my current patients needed that stuff without
Hmm.
knowing they needed that stuff, I realized, all right, I got to get all in on this. I got to bring this to the Philly area, because I saw firsthand, and I was desperate that I was like, okay, I'll get on a plane
Yeah.
and go to Nebraska. But not everybody will, and that's not their fault.
Right.
Um, and even when you go out that first time, that's not the cure. It's not
Right.
like, hey, just go out there one time, you'll be all good. It's what gives you the tools to then allow your body to find its way to heal itself and get things back on track. So even if somebody did go out, they would still need some help navigating the steps in between, once they have this. And
Sure.
also around that time, I was also working as the PT supervisor for an orthopedic practice in the Philly area. And I knew I needed to get really good at this stuff, because some of the treatments, as you know, Chris, are not always the most uh, traditional as far as
Mhm.
what you're asking somebody to do. We blow
Mhm.
up
Yeah.
balloons
Right.
sometimes, and all this to help, you know, uh, manage core pressures and reposition the diaphragm and all that. And there's biomechanical reasons as to why we're doing that, but it can look a little bit unorthodox sometimes. And, I was in an office where I was working with a lot of orthopedists, and some of them were bigger name orthopedists in the Philly region. Some of them had been, the team doctor for NFL teams, and I had to be able to defend why I was doing the stuff I was doing and explain to them how it correlated with what they were seeing on that person's MRI report or what that person's X-ray, and so as they started to have a better understanding of it, and they realized what was going on behind it, then they was like, okay, well, it makes sense now. Patients are happy, so we're happy. But early
Right.
on, I needed to make sure I was on my game
Yeah.
as far as how this stuff all pieces together. And so that also forced me to say, you know what, I got to be all in on this. I got to get certified in this and give myself some validity to it. No, it's certainly been a blessing for me personally, and professionally, it's certainly allowed me to, I think, bring a different view lens to help some people who have tried a lot of different things, give them a different option, and uh, and it's been a fun ride.
Yeah, I can tell you that's a powerful story, by the way. Like, and I think it speaks to the how holistic this methodology really is. But I
Mhm.
know, like, I came from PRI, and I think I started with a little bit more of a skeptical eye on the whole process. But
Mhm.
there was a lot of hype when I was and
Mhm.
our mutual friend John Herding, he really was
Yeah.
promoting it. He was telling me I gotta look into it more. And I think we met at an SFMA, he and I, and he's just like, this stuff is good, but like you really got to check out PRI. And I think I did the first couple home study, right? Like so
Yeah.
I was I was doing it as I'm doing other things, and you have to really pan out, I feel like, to understand the specifics. It's such a broad learning process that it
Mhm.
took me a little while to put the pieces together in a manner that I could find useful. But
Mhm.
it really is like a gift that keeps on giving. And it makes things that I think were once like really esoteric in my view make a lot more sense in a very, very practical and useful way in the
Yeah.
body.
Yeah.
And but it is really important that you have like a group of people that you can talk to about this that kind of even have a different practice in the way that they use it. There's going to be, like really specializing in the use of PRI, and then there's the integration of it with other things. Like there's many different ways I feel like it can be utilized, and the bigger your community, the more you see how people are integrating it with practices that are more fitness oriented, that are more, again, connected to even
Mhm.
dental, connected to even fitting it into a traditional in-network model of physical therapy. You realize like it has the potential at least to be such a foundation of
Yeah.
how you work as a physical therapist, but even as any type of movement professional. And it definitely took me a little while to get there.
Yeah.
And now I just feel like every bit of coursework that I'll take from them, it just opens up like another door.
Yeah.
And then it's like I don't think everybody's always ready for every
Mhm.
course. You know what I mean? Or
Right.
yeah, you might have to take it again. The first time you take it, you may not get a lot out of it. But
Mhm.
it is interesting to see, like, if I go back and look at the first course I took, how that material makes so much more sense to me now than it did when I first
Mhm.
learned it. And and it
Okay.
connects to other things I've taken too, which is nice, where it doesn't stand alone. Like I need to kind of wholeheartedly like give up everything else I've done. It like just fits in with other things. But you just again, you're working from maybe a different starting point in your head.
Yeah, it's so funny. I say to patients all the time, they'll say sometimes like, what are we doing here? And I'll say, well, who are we talking to? Do you who do we need to send the report to? Is it the orthopedist?
Hmm.
Can have that conversation, and I can explain to them what's happening at the knee joint and the relationship between the tibia and femur. Or is it the neurologist? Because we can call them up, we can explain to them what we're doing and why we're doing it. Is it the psychiatrist sometimes? Because we can explain to them, or the psychologist, we can explain to them.
Hmm.
you know, sometimes, and like you alluded to, it can be a little bit more esoteric, and you know, sometimes it's the energy healer. Are we
Right.
talking, you know, and
Yeah.
how we're channeling some of the energies and chakras and stuff.
Right.
And I
Right.
tend to know enough about to say I'm ever treating a chakra,
Yeah.
but you know, the more I do hear about that kind of stuff and learn, I can see some of the correlations
Yeah.
and the dysfunctional things. I have a funny story actually with when I was at that orthopedist practice, and it was early on in my PRI days, and I probably wouldn't have treated this the same way uh, today. But at the time, I had this patient, and she'd come in. She had a confirmed ACL and meniscal tear, and she came in for a couple of sessions. The surgeon said, I want you to go to PT, get this knee straight before we do the surgery." So he said, "I'll give you a month to go get it straight." So she came to a couple of sessions, and then she fell off. She stopped showing up for a while, and then she came back to see him, expecting that he'd be like, "Okay, yeah, let's just schedule the surgery now." So she
Mhm.
goes in to see him. The knee isn't straight, and he goes, "Well, I'm not doing it. You know, you gotta get this straight before I'm gonna do the surgery, right?" So her appointment with me was scheduled to be right after uh, him. So she comes in and she is hysterical and crying,
Mhm.
and you know, because she needs this surgery so she can get back to work, but he won't do the surgery, right? And she's like, you know, just hysterical crying. And you know, she's probably missing about 12 degrees, 15 degrees of knee extension. And you know, and I'm thinking it's like a busy clinic, and I'm thinking, "Oh, what am I gonna do with this?" Right. So I uh I just handed her a balloon, and I said, "Here, let's blow this up." All right. And so for anyone who knows PRI, you know about what it is. But if you don't know about PRI, the use of a balloon kind of helps us engage our abdominals in a way that helps inhibit the contraction of the contracted state of the diaphragm and the psoas and a whole chain of muscles that kind of come off of the lumbar spine that can kind of be overactive. And in her case, she was hyperventilating. Her diaphragm was in this
Yeah.
contracted
Right.
space, right? So I'm thinking like, all right, I'm gonna at least help calm her down now, right?
Hmm.
Um, and so she blows up the balloon, and I walk her through with the nasal cycling and this and that. And I said, "Okay, now you can go ahead and lay down." And she lays down, and and the knee's straight. And I'm like, and you know, this again, this is still early on in my career, but I said, "Don't move. I'll be right back." Right. So I run down the hall. I go down to the orthopedist, and this guy, I mean, I mean, he had been the orthopedist for an NFL team for a while. You know, the ego wasn't the smallest, right? And I said, you know, Doctor So and So. I said, I know you just saw. I don't remember her name. We'll say Lisa. I said, I know you just saw Lisa. Um, you know, I just did a couple quick things with her. Like that knee's actually straight now. Like you might want to reconsider on the surgery. So he kind of like rolls his eyes and he's like, "All right, I'll be right down, right?" And so now a couple minutes later, he walks into the clinic, and you know, it was the kind of thing where like when he walks in, everybody like sits up straight and like
Yeah.
breath, you know, kind of. And so he walks over and he goes, "All right, let's see it." And so I said, "Go ahead, Lisa." So she lays down and bam, completely straight. And he looked, I'll never forget his face. He just turned and looked at me and he goes, "What did you do?" And I couldn't just say we just blew up a balloon, right?
Yeah.
So I had to say, well, you know, she had some hip flexor muscles that were kind of
Right,
protected things.
right,
I
right.
had to inhibit those and kind of line up the pelvis and the rib cage a little bit better. And it was like he like didn't believe it. So he goes in, he does some manual stuff again, and you know, he checks the Lockman's test and all this. It's like he was almost like, did I miss this? Like, is it really not? And and he goes, stands back and he goes, "All right." He goes, "Well, you know, Lisa, when you're done here, come down and we'll schedule you for the surgery." And then he walks out, and and then the patient turns to me and she goes, "Do you think I even need the surgery?"
That's a fantastic story.
And I said, "Well, yeah, I think in this case,
Yeah.
probably get the surgery,
Might as
right?"
well, yeah, go
But
through it.
but no, it just spoke to me early on the power of this stuff and how the ripple effect that it can have through our whole system.
Right.
Whether it's regulating your body's parasympathetic versus sympathetic state, whether it's, helping optimize an airway so
Right.
you can breathe better or snore less at night, or treating musculoskeletal things. So what my role in this is to help give everybody the best foundation, the best starting position. I'm not a strength trainer,
Mm-hmm.
but I work with a lot of pro athletes, and we work on making sure that their foundation is stable and even and balanced, and that they can move in a balanced way on both sides of their body in a less compensatory way. And that helps them with their strength and their performance. They'll have a better workout afterwards, or they'll
Mm-hmm.
have a better game that afternoon, or they'll feel like they have more power when they're pushing off, or something like that. But my clients are everybody from pro athletes to just grandma who just trying to get to the mailbox and back, and everywhere in between. So I like to help people find a peaceful state for their body, one that can just and move in a balanced way on either side of their body, and not be biased by their need to breathe or compensate in a certain way because of other things they have going on.
Mm-hmm.
And and I think that whether you're trying to do high level stuff, or you're just trying to get out of pain, usually there's some imbalances that can help things work more efficiently. Unfortunately, when we see that when we can get things in better balance, a lot of times those painful conditions, those frustrating recurrent pains, kind of dissipate. And so when we can maintain that balance, and we have a battery of tests that we use to help us know about the position of things going on in your pelvis, rib cage, head and neck. When you can maintain it and you feel good, and then you want to get stronger, and then okay, now
Yeah.
go to the gym, but be this version of you when you walk into the gym.
All right. Yeah.
And when you're done working out, maybe do a couple of these things to kind of undo whatever that round of golf or whatever that workout might have done to you, to kind of
Yeah.
twist you up a little bit. So
Absolutely.
that's kind of how I see, my role in it.
Yeah, and I'll say from like my perspective, my job now is almost more on the strength and conditioning side of things, although I do work as a physical therapist, and it's just more of a hybrid model. So
Yeah,
I don't often, not as that I don't have the time, it's just that it doesn't fit into the flow of the session to put people on
sure.
tables and things like that anymore. And it used to, and it's just interesting how it's blended away from that. So I'm still able to use these principles.
Hmm.
And this is where I look at the learning and the methodologies. They're sort of like a spectrum of like, can you get things from a very global perspective and still understand the asymmetries and how that fits in just like a motor learning perspective? And
Hmm.
then can you, if you needed to, could you really dwindle it down to the specifics and be able to explain it from a very specific standpoint? And that takes time to be able to go from both avenues, right? Like be very specific and then also be able to pan out and look at the interactions of the systems in the body. And even from a communication standpoint, it's so valuable to be able to go both ways with the way that you're discussing things, right? Because I find that I'm rarely getting into the nitty gritty specifics because I don't need to, because I'm more
Hmm.
in the flow of a movement session. But
Yeah.
there's just certain contact points, certain cues, certain ways of using constraints that can tie into this model that is naturally asymmetrical, right?
Hmm.
So not looking at trying to be even with contacts on either side, but maybe biasing one side more than the other. And I'll tell you the one course that was really a game changer was I&I, impingement instability, because it just took the gait cycle, just walking, and it took stuff that had been learned in other classes, but it really did dwindle it down to just contact points throughout the body, head to
Yeah.
toe, that is in a movement process that we're all doing all the time. And whether we're a therapist or whether we're a strength and conditioning professional, we can always bring things back to walking as an assessment that can be understandable to somebody who's not, doesn't have the lingo, doesn't have the language behind it, but
Yeah.
just, all right, can you feel these things? And when you do feel these things, right, like you don't need to have the language. It just is like, oh yeah, this feels better, right? Like I feel heavier on a side. I feel like I'm alternating better, right? Like these things become very obvious, I feel like, once they start to happen.
Mm-hmm.
But to get people there is difficult. And that's just the art of being a clinician in many ways, right? Like you have to have the art of communicating when what you know and getting it to
Mm-hmm.
somebody else. But I feel like even in the learning process, it is such a broad process of being able to learn things from a broad perspective, but also from a very specific perspective. And you need both. You need both ends of the
Absolutely.
spectrum, and you
Yeah.
need to be able to constantly move in and out of both ends of the spectrum if you're communicating it to others.
Mm-hmm. Well, and I know, Chris, I know your skill set tremendously, or that your tremendous skill set that like, you can watch somebody walk in and know how you're going to bias their workout that day.
Mm-hmm.
You're kind of treating their gait cycle,
Right.
in a way that, and you certainly have the knowledge and skills to be able to know what's safe to load them up with and be treating the gait cycle, even if it looks something like with a kettlebell in their hand or something like that.
Mm-hmm.
So yeah, it's definitely a cool, fluid uh, spectrum to be able
Yeah,
to work with.
absolutely.
Sure.
I'll tell you, something I've always remember from our sessions together is trying to integrate the like the dentation, the jaw and all of that with what was going on down lower.
Yeah.
It was taking me a little while to like put that together. And I remember you just said like your back left molars are like your left heel. And I was like, oh shit. That like just opened up
Yeah.
like a whole line of thinking of just, how we're loading versus unloading. And then I've taken some coursework with Bill Hartman and they,
Mhm.
he uses different terminology, but you could tell it was so much easier to understand where he was coming from, having that background first, right?
Yeah.
And it's not that his stuff is easy and by
Sure.
any means I have a complete understanding of it, but it is just like I think I would have been completely lost if I didn't have that understanding of like loading and unloading throughout the body, right?
Right.
And he uses the term iteration all the time, where your rib cage and your pelvis have iterations that are almost
Yeah.
identical through the body, but if you're having a hard time getting some type of understanding of one area because of how small the anatomy is, you can look up an area that's a little bit bigger or easier to palpate up the chain.
Exactly.
And then I
Yeah.
think that just goes throughout the body. But like the stuff with the airway and the TMJ, I took a lot from just our couple sessions together. But
Mhm.
that's something that stays with me because I've used that so often in my own type of work, and just the difference between like back molars, like where my tongue position is. I've
Mhm.
done some like biofunctional therapy now, and
Sure.
like how that opened up so many doors for like, oh yeah, like there's all these muscles and things that you have control of within your mouth, around your jaw, that they're just sort of going for the ride a lot of times unless we give them some type of intention. And when
Yeah.
we do, it's a game changer of like, all right, now I could breathe a lot better. It's a lot easier for me to have aerobic capacity because I'm not fighting myself. Allow my respiration to match the effort of my muscular system, as opposed
Yeah.
to like just have your respiration kind of take off
Mhm.
because all right, your brain is telling you this is supposed to be hard. Well, you made it harder than it needs to be too soon. The concept of how to build performance has really skyrocketed with this understanding of tying the airway into everything around it. And
Absolutely. I
yeah,
tell people all the time, we need to make sure that we're not allowing your need to breathe to control you.
yeah,
And so when we can encapsulate the airway, the diaphragm, all the things that put the pelvis and rib cage in a better position, put the head on the neck in a way where you're
mm-hmm.
tension on your brain stem or your upper cervical area, then your body's ability to breathe can be strictly respiratory rather than one that's also trying to help stabilize you
Right.
and manage some pressures that it doesn't have to.
Yeah. Like I think this is what integrates things like mindfulness, right?
Yeah.
Is when you have a practice of mindfulness, like you make that an important intention in your life, you really start to notice that like, that's always occurring. You can call it a struggle or whatever you want to call it, but there's always this kind of back and forth between how much you're just allowing and accepting in any moment, and how much does the task at hand not really call for that, and you got to kind of be on an attack mode. But when is there a mismatch? When is
Yeah.
there like, are your body's sort of going into physiological attack mode, but you're not attacking anything. There's nothing to act on, right? Like you'd be way better off just like accepting and being, and just the difference in the physiology there, which is autonomic. Like you have control over it if you give it mindfulness, but it's really meant to be sort of automatic in the way that our physiology responds to, the environment more than anything. So just having that starting point where somebody's just bringing this up to you, like that there is some control that we might have over that.
Mhm.
And if our structure is put in a way where we're biased towards there being more pressure around the airway, right, at any moment in time, certainly that's going to turn the volume up on our
Right.
fight or flight system, our action system, right? And that is basically like, how are we going to relax when we're supposed to be relaxing when the body doesn't recognize things as relaxation, right?
Right. Yeah, and I tell people all the time we need to put you in a state where we're not fighting your own neurology. You know,
Yes.
our brains are still the primitive brains that helped us survive. You know, our limbic systems have not evolved a ton past when we had to get away from the saber-toothed tiger, you know.
Mm-hmm.
So but now we got all this extra stress in our lives, and
Yeah.
there's things in our modern day world that don't allow us to access some of the mechanisms intrinsically that kind of help keep our bodies better regulated. Back when, yeah, we had to run from the saber-tooth tiger, we had to get away from
Mm-hmm.
that, but then like we could kind of like recalibrate. And
Yeah.
now, you know, with our cell phones and all sorts of other things, we could talk forever on this, but
Yeah.
like there's a lot of things in our modern world that keep our bodies so stressed, which has an automatic, autonomic, physical response
Right.
that'll cause certain predictable changes in the body. And for a lot of people, it helps them cling more into these asymmetric patterns that are most familiar to the body based on the body's asymmetry. So um, sometimes it's because of the world around us, and sometimes it's because of the world within us. But like you were talking about, you know, the iterations. And so that really opened up a box for me when, you know, I started to understand that, you know, in someone's TMJ, the T, those temporal bones, they move, you know,
Mm-hmm.
and those temporal bones have a sphenoid between them in the same way that our pelvic bones have a sacrum between it. And when you started like testing pelvises and looking at people's faces, and you could see that their temporal bones tell you a lot about what's happening in their pelvis, or vice versa, that their pelvic position and bones tell you a lot about what's happening up in their cranium. It almost seemed imperative that we say, look, sometimes we need to get a dentist on board with this,
Yeah.
because you may have chronic back pain, or you may have a chronic pelvic tilt or whatever, but maybe it's because your body was in a little bit of a twisted state when you got braces when you were 14 years old, and
Yeah.
they perfected the position of the teeth. So now you got a great smile, you know,
Mm-hmm.
a beautiful smile, but it's it's locking in the twisted state of the bones around them. And until
Mm-hmm.
we lock that in some way, it's going to be hard for us to unlock this pelvis, because that pelvis is really just trying to balance you out
Right.
based on how your body has processed its sensory information above.
Yeah.
And sometimes it's, you know, it's the way the teeth touch.
Mm-hmm.
Uh, but and then as I started to learn more about the families, like you said, like, you know, so you got these pterygoid muscles that do at the jaw,
Mm-hmm.
what, you know, the adductor muscles do at the pelvis, and we
Yeah.
got some posterior capitis muscles at the suboccipital area that do what the glutes do at the pelvis, you know.
Yeah.
So then it started to get really fun and investigating these parallels and saying, okay,
Yep.
well, we got this persistent issue here. What's going on here? And sometimes it's easier to go to the other place and treat
Right.
that. And then the area that's being stubborn, or we thought was being stubborn, just kind of falls into place. And really, that guy wasn't being bad. He was doing
Mm-hmm.
exactly what he was supposed to do based on those conditions. And that's one thing that I really enjoy being able to show people, is that, look, like, your body's not broken
Mm-hmm.
any means. These areas that have been frustrating you and giving you hell for days, months, weeks, years, sometimes decades, um, that's what human bodies are supposed to do based on those conditions.
Yeah.
We just give your brain and your body a different menu of options. We got to give
Absolutely.
it, you know, so based on the menu it had, it was doing the best it could, but
Yeah.
it wasn't doing anything wrong. It's not broken. That's a normal, healthy body's way of compensating based on that limited menu of options. So
Yeah.
I just try to give people more options for and a lot of times that helps give us a better foundation to set things up for success and then ultimately loading.
Yeah, I think you said like a lot of really good things there that, to touch on. It's just this idea of options, which can be tied into movement variability, right?
Mhm.
Like that is ultimately what I think our goal is as movement professionals, right? Like, and the more understanding we have, like the more we can dive into like the smaller areas of the body, we actually unlock, for lack of a better way to say it, like things that were fixed, right?
Mhm.
And then we can that takes us into this idea of certain types of orthotics, certain types of
Yep.
bracing, right? That keeps the body in place in one area. There's going to be downstream, upstream effects of that,
Sure.
and it's going to give us less options for movement. Now, certainly there is a time for that when the options for movement are unstable or something like that. And this is why bracing tends to happen. But we have to appreciate that it doesn't stop with the bracing. Like you brace one area, you cease to have that area able to move. Something is going to respond to that somewhere else through the body. So again,
Yeah.
taking this as far back as we can into the most holistic viewpoint is like your body is trying to create a balance for with gravity. It's like it's working with gravity at all times, and a lot of times that's the secondary effects of like you lock something else down, well something else has got to move, right?
Yeah.
And I like, there's a lot of just natural physics, even if you take the human body out of it, just to you create a lockdown in one area. Well, pressure is going to move to the path of least resistance, and that's going
Yeah.
to happen throughout the body. So the PRI work really made me start looking at the body like that. And a lot of Bill Hartman's work too is like it's more of a hydraulic system than it is a bunch of pulleys and
Yeah, it's
levers,
a
right?
water balloon.
Yeah,
Yeah.
we're moving pressure around, but if you lock an area down, like basically have blocked a compartment where
Yeah.
that fluid could flow. So we've taken options away, and if we give more options, now we got to be able to control those options too,
Exactly.
right? So it's not just like, all right, like free this up and you're all good,
Right.
but the awareness that it's not just the big joints that move, right? Smaller joints, sutures throughout in the skull, like all of those things have motion, and we don't necessarily have to specify every single one, but that there is this appreciation that I think if we could start from the finish where we kind of put people in the positions that they don't feel comfortable being in, and try to get them more comfortable in those positions over time.
Mhm.
Or we could start, maybe with the more finite details and free that up. But eventually we got to look at both sides, right? And I think that idea though of giving more options and seeing when you take options away with different equipment and bracing that there's going to be an effect there. And
Yeah.
it could be our job to see where those effects are, and we don't have to make people afraid of those effects, but we just appreciate that if there is a symptom that we might have to backtrack from, it can be related to just not having options where they need options.
Yeah. No, absolutely. That's well said for sure.
Very cool. So what are you looking forward to in the future in our field? Are you anything you're really excited? I like asking this question to people in the
Yeah.
field.
You know what I think, Chris? I think that, our field, for the people that really care, they're getting a better ability to establish their own identity, as far as their ability to really help people and and have their specialty kind of showcased. And I think that's important for the field because I think that 20 years ago, for the most part, if someone went to PT, they'd be like, I don't know, I went to PT,
Hmm.
and it was only because my doctor told me I had to go for a month, and that was it. And maybe it was because they had a surgery, or they might have had some acute ICD-10 diagnosis, and they don't know who their PT was. It was some guy, Joe, down at whatever. Or maybe each time they went, they got a different person, and all that. And sometimes that still happens. But I think that, and the way I like to structure it, and the way I know you do, and the people who are like-minded to us, we really kind of embrace that we are practitioners for life with our clients and our patients. And in the same way that these clients have a dentist for their dental system, they have an optometrist for their visual system, and they go for their checkups every so often, whatever. Well, we're their people for the movement system.
Right.
And what I like, what I think is that the mindset of the community is changing in the sense that people are seeing how being able to stay on top of these things is going to help them stay ahead of issues and also keep them moving and doing what they like to do. And maybe they do tend to get a little back pain here and there, but okay, if I see Chris every so often, it helps me stay ahead of it, and I can still go golf however many times. We're being, I think, the PT profession for people that look at it the way that we do, people that are committed to the clients and are have close personal relationships with their clients. I think that you're going to see more of that. You're going to see
Yeah.
more PTs that say, you know what, I want to really be able to control the experience that I provide to my clients, and they're going to be, just as much of an important part of someone's lives as, I keep coming back, their dentist
Right.
or their cardiologist, or their
Yeah.
GP in some ways. And I think you're going to see more people that are realizing, like, maybe I don't have to, finance a whole clinic and outfit it with all sorts of equipment.
Right.
Maybe I need to just find a space where I can, rent a little space from a gym or whatever. And people are going to build communities that way. And I think things like social media are helping people, get their voice and showcase their unique specialties and talents, because we're not all the same as far as PTs and how we look at things and how we treat things. And so being able to, as clients are becoming better consumers of their healthcare, they're going to be able to, look and see not just like, oh, do I need PT, but like, what kind of PT do I want, or
Right.
what kind of
Yep.
PT do I want to work with? And I think the more that PTs feel empowered to showcase their unique skill sets and talents, you're going to see more cash based. And there's still going to be the big name companies out there. But I think that there's going to be more and more opportunities for people doing it, maybe like the way you and I started to.
Absolutely. No, I agree. And I think, just like we talked about giving people more options for movement, there's more options for physical therapy. Like I'm hopeful, and one of the things I try to do with this podcast is actually just show people all the different options for a good movement professional. And the terminology of movement professional is really trying to take that scope of practice of, where we're distinguishing, like a physical therapist is like a certain entity and a chiropractor is a certain entity. It's like, now there's shades of gray within our own field, right? And a physical therapist could look a lot like a chiropractor and a strength and conditioning professional, and who cares, right? Like we all we have our certain education that we went to school for, but the education always continues after that. And when you start to get outside of the model, like you're saying, like the model of being in an in-network facility where you're really tied into how many people you're going to see in a certain hour, it's like you don't have enough time to actually find what you're good at,
Right.
or you're certainly not going to be able to optimize what you're good at. So I think once we're figuring out as a profession what our worth is by being able to start our own practices and do it a little bit differently. Like we were talking before we started recording here about, like, you're in several different locations, and you said you like them all in a different way. And I think that's awesome, right? Like, every environment is going to be different, right? So
Mm-hmm.
I have my clinic in Ardmore now, but I used to travel to different people's homes, and that was a different thing, which was kind of cool, right? Like to see how everybody's environment, their home environment, is going to change the situation. You have to get more creative to deal with the different environments. But then if you get to be around different people, like it sounds like you are when you're going to different locations, well, now you're going to be able to work and collaborate off those different people. Like, so that's kind of what I'm excited about, is like that openness to collaborate. Like I see it so much, like especially in this cash-based community, is no,
Mm-hmm.
people aren't competitive. They're not like worried that someone's going to take their business, because you see it right away that it's not useful, and it's way more useful to be collaborative and learn from that person, refer to that person, get referrals from that person.
Yeah.
And it feels good because you make friends that are like-minded, and things like that.
Absolutely. Yeah, yeah. Actually, some of my some of my best relationships right now, um, and the ones that I value the most on a personal level are ones that technically early on paper could have looked like competitors, you
Absolutely.
know? And so it's
Absolutely.
it's funny how that works, and that took me a while to get over that, just with my own personal journey, to realize like, no, this is all, it only comes back good, and
Absolutely.
when you have the right intentions and it's focused on helping people in the best way you can, delivering what you can bring to the table, which is different than what you're going to bring to the table, Chris, or what, any other PT is going to bring to the table. And I'm not always by any means the only person that can help somebody, but and
Right.
there's and um I try to be that for as many people as I can by continuing to learn, but I know you do the same,
Yeah.
and so it's always got to work well for the patient, and that's what everything that I try to do, and everything I know you try to do, and everything John tries to do, it's all about providing the best experience for the patient that we would want if we were the patient. So
100%. I think that's well said. Great conversation, Frank. It was good to talk to you.
this is
And
awesome. Thank you so much for having
absolutely.
me, because I remember when we first met. You, I think, had just left that location in Northeast Philly,
Hmm.
and you were kind of starting your own thing. And I remember having a lot of admiration and respect for the kahunas that you had in doing it, and it's really incredible, impressive, not surprising, but it's really great to see how far you've taken that, and how well you're doing, and I'm honored to be here just talking with you today. So thanks for having me.
Well, likewise. Right back at you.